is Ginger Bandeen. I'm a clinical social worker turned data person, and I just thought I would take a minute to share a recap of my experiences at the National Council Conference. If you're not familiar with the National Council for Behavioral Health, they've been around for a while. Actually, this was their 50-year anniversary. They represent community behavioral health providers, so your community mental health agencies, whether those are nonprofit or run by government agencies. A lot of different folks from all across the country talking about how to improve the community behavioral health system. Or maybe even you could say the entire behavioral health system, or you could even get broader and say the entire healthcare system, because we're certainly now a part of the overall healthcare system. Anyway, I just thought I would share some of my impressions from the conference. I think there were some main themes that were different this year. I would say, for one thing, that there was a much greater focus or a more openness toward the idea of harm reduction, and I think that stems from our awareness as a country that overdose deaths we need to do everything we can to prevent people from dying from overdose, and that there are strategies we can use that we're not exploring, and we need to open our minds up to those ideas. So I was really excited to hear from speakers who spoke about safe injection sites. I hope that's a direction we're moving in this country. I believe right now there's some movement toward that in several states, and I think we need to be all about that. We need to be keeping people alive. So I was excited about that. Another theme had to do with the shift in leadership, and I think that was intentional by the National Council. As you may know, Linda Rosenberg, who is the executive director of the National Council for, I believe, 15 years, was stepping down this year and will be replaced by Chuck Angolia. And I think that led them to kind of be thinking about, in general, how in our field, a lot of executive directors are possibly now at this stage where they might be thinking about retirement, and so there was a little bit of a focus on how to foster leadership in the next generation of leaders, and I was really excited to see that. The third theme, I would say, was around how technology is going to impact our field. So they had some speakers there talking about value-based payment, talking about data-driven decision-making, and also mental health apps, which I think we're still trying to figure out how we're going to use those. I think there are some agencies doing some interesting things. I think we still need to think about when that's a good use of technology and when face-to-face or even text-based interaction with the human counselor might be more beneficial. But that's interesting to see. In terms of data, I think we're still just on the cusp of figuring out how to demonstrate our value to the healthcare system or to our communities in general when it comes to behavioral health. So I had several conversations with people where we talked about that we hope we're moving in the direction of even a deeper dive into our data, that just looking at productivity, the number of clients we've served, the number of services we've provided, that's a great baseline, but we need to get better at showing that the folks we are reaching are those who are most profoundly impacted by trauma, who might possibly be the most socially isolated, and who could most benefit from a community level intervention. So I'm looking forward to how we can use data to demonstrate that. I think that's the ticket to us really showing to the healthcare system what our story is, what behavioral health story is. So I was excited about that. The conference itself is in this giant hotel. They had like millions of plants everywhere, and I am terrible at taking care of plants, so I was very impressed that they could keep all those plants alive. And the other takeaway I got was, as an introvert, I tried a new experiment this time where as I was walking from session to session, I would try to strike up a conversation with whoever I was walking next to, and I strongly recommend it. It was a great opportunity. I got to have some interesting conversations with people I wouldn't have talked to otherwise. Everyone seemed to kind of enjoy having someone to chat with anyway if we were processing a session that brought up some interesting ideas, and I met great people. So just a little tip for you introverts out there, sometimes it's worth taking a little step into the extrovert land and trying that out. Anyway, those were my takeaways, and of course you can never make it to every session, so if you learned different things, please let me know. I'd be interested to hear what you heard or saw or learned at the conference. Thanks so much.